Hi, this is Dr. Cho from Integrated Aesthetics, and we are doing a circumferential liposuction of the trunk and a tummy tuck procedure. This is a great way to help contour the whole profile as well as the sides and the back to get much more of that hourglass shape. Stay tuned after we turn our patient over so we can go on with the liposuction of the front as well as the tummy tuck. So we're here continuing our journey for our patient, and her journey is going to involve removing all of the skin here as part of a tummy tuck procedure. So all of this will be gone. This line here will then come down to this line here, and that's going to give her a much flatter and tauter abdomen that you can kind of anticipate what that might look like here. In addition, we're going to be doing some liposuction here, 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 and the other side. We're also going to be tightening her muscle as part of her tummy tuck procedure, and that's going to help considerably to create that flatter, more contoured abdomen. In addition, the liposuction to the sides is going to help create more of that hourglass appearance, and just previously we had finished up the liposuction to the back. So this is going to be a wonderful procedure for her, and I'm very excited. Okay, so this is Dr. Cho. We're continuing on with our tummy tuck procedure. And what you can see is this tissue has been undermined all the way up to the belly button. The belly button is right up through here. We're going to continue to dissect underneath the abdominal tissue all the way up to the sternum to help tighten the muscles underneath. So you're going to see all this tissue that I'm holding up, that's all going to be removed, and then the skin's going to be pulled down tightly. So stay tuned. So we've now dissected the abdominal flap all the way up to the sternum. So if you can go all the way in there, you'll see how deep it goes in. And this blue marking that you see the boundaries of, this is the abdominal tissue that we're going to be sewing together. So this is going to be moving into this direction, this one's going to go there, and that's going to create a tighter six-pack appearance as well. Here's an example of the suture that we're using to help with that. And you're going to see how the tissue starts to cinch, but you'll see how that's coming together. And this is a vital part of the tummy tuck procedure to help tighten the musculature and also create a flatter appearance so that the muscle pushes back on the abdominal contents. This is an area that typically stretches for women who've had children. Or for people who have gained and lost a lot of weight as well, because the tissues will stretch and they don't fully regain their elasticity. So you can see how the blue lines are now coming closer together in its appearance. And again, this is a highly rewarding portion of the procedure, which you can't do with just liposuction alone. Demonstrating the abdominal plication, abdominal wall plication during a tummy tuck procedure. So we're continuing our tummy tuck procedure, and what you've seen is that we've sutured up the abdominal wall so it's much tighter. We did that above here as well. We used to have two wide blue lines that we've sutured together, so we've closed the gap about 2 inches on top and about 3 inches on the bottom. People will often ask, why do we use drains? And we use drains to help close off these pockets so that it seals down. This tissue will generate a lot of fluid, and we want that fluid to come out of the body rather than accumulate in between so that the tissues will stick after we do that. So I typically put one drain oriented vertically up like here, and a second drain oriented more horizontally like here. And we're going to be cutting off this tissue, then pulling things together. So we're now taking off the excess skin. Start with one side. So that's what's going to happen when we reapproximate that tissue. So significant amount of skin removal. are completing our tummy tuck procedure. We have removed the excess skin all the way across. You can see that she's much tauter than before. And what I'm doing right now is I'm bringing up the belly button into its new hole and new incision place. So she's going to have a small incision around here. And she's going to be very pleased because we contoured a lot of this down. We've removed a significant portion of her excess skin. And this is a little bit swollen now, so she's going to be a little bit tauter overall. So thank you for watching. This is a tummy tuck procedure with circumferential liposuction, and we're at the end stages.